I'm Dr. Mudit Khanna, Consultant Joint Replacement Orthopedic Surgeon at the South Mumbai unit of Wockhardt Hospital. Today we will be talking about the surgical approach that we can take to perform a surgery or a joint replacement surgery essentially. Now there are two kinds of surgical approaches that are most commonly used to perform this particular surgery. One of them, and the more commonly used approach, is the traditional medial parapatellar approach, which involves cutting through the central tendon of the muscles that cover the top of the knee to approach the knee joint to perform the surgery. The other approach, which is a minimally invasive muscle sparing approach, involves lifting the muscle completely from one side to the other, performing the surgery and then letting the muscle fall back on its own place after the surgery. The latter, or the second approach, is typically a minimally invasive approach that does not involve cutting through the muscle. The obvious advantage of this approach is that the muscle is much more stronger after the surgery, much more quicker it is stronger after the surgery. The disadvantage typically is only the fact that it is a little more challenging to perform this approach, but we've been using this approach for many years now at Wockhardt Hospitals. The major advantage that this approach provides is that the recovery and the rehabilitation process for all patients is a lot quicker. They're able to extend the knee right from within a few hours after the surgery, which may or may not be possible with a traditional approach. Also, the pain relief offered with this approach is much better compared to the pain relief that they receive after a traditional approach. They are much quicker to get back on their feet and are much faster to recover. Now, this approach may not be technically feasible for every patient undergoing a total knee replacement surgery, but I would strongly recommend every patient undergoing this procedure to discuss the possibility of utilizing this approach for their knee surgery, because utilization of this approach may improve the overall outcome, give better pain relief, and get them back on their feet much faster than a traditional approach.